Hi, everyone. This is Destiny from Confessions of a Former Healthcare Worker. And I know it's been a long time since I've updated my little podcast. I got a new job. I am back to being a news reporter for the Punxsutawney Spirit newspaper, which is really exciting. Because I'm a writer, I love to write. That is my true passion. But I'm also here to share my experiences working in the healthcare field in hopes of helping others who are considering going into that field. Um, I would like for people to see this podcast and feel free to comment on it because this is to, prepare whoever wants to go into this field for what to expect. Because it's if you choose to be a PCA, which I'm going to talk about, it is a very difficult job. It can be very stressful. It can be very overwhelming. But in the end, you walk away knowing that you made a difference and that you helped patients. And I can guarantee you a lot of patients that you help will never forget. They will always be grateful. I have found that. I have had patients who I helped who I didn't even remember who mentioned that I made a difference, and that's very rewarding. So I'm going to talk about working in the rehab unit as a PCA. It was the hardest unit I worked on, aside from the second floor. There were basically 8 rooms, and sometimes there were 2 patients to a room. Many of these people were stroke patients. Other ones suffered some sort of brain damage, or they had something else where they couldn't move. So basically, you go in at 6, you get your reports, and then after you get your reports, you're told what patients you have to go and get up, get dressed, and ready for breakfast. Usually new patients, physical therapy would come in and they would work with them and help them get dressed and see what they could do. But you were responsible for the other ones. And it's very challenging. You have to first, before you take the patients out to the dining room, you have to make sure that the doctor has seen them all first. There's usually 2 doctors that worked on the units. I didn't really associate with them. I will say that, PCAs, doctors don't really listen to. I could be wrong, but my experience were frustrating because we often spend more time with the patients than the nurses because the nurses are busy having to do a lot more medical charting, handing out medications. They're often, very busy. So PCAs, they spend more time with these patients, especially when you're getting them up, you're getting them dressed, or you're going in, you're taking care of them, and you notice something's not right, and you try to tell the doctor. The doctor doesn't really listen to you unless you're a nurse. If you're an RN, they will. If you're an LPN, they will. But if you're just a PCA, I don't know. Like I said, maybe it's been different for some people, but it was frustrating for me because I didn't think that was right. I often felt like to the doctors I was invisible, and it was frustrating because if I noticed something was wrong with a patient, I wanted to say something. I wanted to be heard so that they can get taken care of. So that's a frustrating part. So you have to go and you have to also get AccuChecks done on certain patients, which is also very stressful because you have an hour to get all these different patients up and dressed and into the wheelchair and taken out to the dining room because they have to be out there by like 8 o'clock. And then you have to go out and, help certain patients, if they're having trouble. Kind of observe, make sure that they're swallowing properly. I mean, speech therapy, they did, do a lot of that, but PCAs also had to keep an eye on that. You had to document how much they ate. 25%, 50%, 75, 100%. You kind of had to use your judgment. And you really had to use your judgment when it came to how much they drank. So that was kind of frustrating too. Then they were taking a physical therapy, and you had to do your medical charting. What all you did, what they did, how much they helped get themselves dressed. You had to document that. You had to document, bowel movements, everything, and just anything you did for the patient, you had to document, or else to them you didn't do it. I will say there was a few RRTs. There was kind of a lot of RRTs. Because the nurses would be observing certain patients, and if you had to deal with somebody, like a lot of stroke patients were to assist, and we were short-staffed, and so, to try and get this patient who needs 2 people to get them safely, sometimes it resulted in, us gently having to go down to the floor. Because if they were gonna fall, you kind of had to make sure it was gently so they didn't get hurt. Um, and then you had to explain to the supervisor what happened, how it could have been prevented, which, if you don't have the help, there's nothing you could do. There was often patients that you had to sit with, because some of them, even though they were stroke patients, they could be violent. You had ones that were just hated you, hated everyone, because they were just so devastated that they were dealing with this situation. So, yeah, we once again had to deal with combative patients, or I mean, I got slapped, I got pushed, and these patients, some of them would rip off their diapers and throw them at you or throw something. And it was, you just had to realize that they were just really frustrated because they couldn't speak, they couldn't do what they used to do. And I'll get into that a little bit later in our podcast, because I did have one truly devastating case that I had to deal with, that still hurts to this day when I think about it. But I remember sometimes it was a challenge. I once had to sit with 2 patients. One that was able to get up and walk. The other one was, a young woman who has suffered a brain injury, and she was just, going crazy because she didn't like being confined to the bed. She didn't understand why she was there. She was confused. So it was hard trying to, you know, take care of both these patients and make sure the one wasn't walking out the door. Um, and, you were short on help. I will say the rehab unit was the unit where I ended up getting a permanent back injury, trying to save a patient who was trying to get out of bed and ended up taking me to the floor with him. And of course, I put myself underneath him because I knew if he would have hit the floor, he would have broke bones. He was a very frail man. So I ended up suffering a very bad permanent back injury that, has greatly affected my health. But I guess I will share my story, if possible, with this woman. She suffered a stroke. She was able to do everything, eat, walk, but she could not talk. For some reason, the stroke affected the part of speech, and she used to sing in her church choir, and she loved singing and she loved talking, and she was so frustrated that she was no longer able to do that. She was the one that I had to do, really do one-on-one with, because we had to make sure she wouldn't try to escape, because she could walk and she was smart. She knew how to turn off the bed alarm. It came to the point where she was told that she would never speak again. So she gave up. I watched this woman give up. She stopped eating. She refused meds. All she wanted to do was lay in bed. And no matter what we did, we couldn't get her to eat. She just completely gave up the will to live, and having to be one-on-one with this patient, I watched her slowly die. By the time that her daughter had her moved to a nursing home, 2 days later, she died. And I remember holding her hand, and I could tell by the way she looked at me that, I'm like, don't give up. Everything will be okay. God has to step in somewhere. And I could just tell by looking in her eyes that she's like, no, just let me die. And she did. And that really affected me, and it still does. Because it was, I guess you realize that sometimes we take our voices for granted. If we lose our ability to do what we love to do, if we lose our passion, it's devastating. She loved to sing, she loved to talk, she loved socializing, and because she was robbed of that voice, she just chose to die. And I just hope everyone appreciates the voice that you have, even if you have a different opinion on something, even if you don't agree with what's going on in the world. Be happy that you have a voice, because sometimes when people suffer strokes, they lose their voice, or they lose their ability to do what they love to do, and it's very, very hard to watch. And with that, I am going to close out this edition. I will share more stories, because there was another incident that happened that kind of basically, it was something I didn't expect that happened. Um, that greatly also changed me. And I guess, what I'm saying is that working in a hospital, you have certain cases that will affect you. Even if you feel like you're made of stone, you could take anything. You will run into circumstances where you feel helpless. And you just so badly want to help this person, but maybe that person has, you know, something terribly wrong with them to the point where they're dying, and there's nothing you could do about it. But there are also other patients who are there who greatly need you, and what you do for them, they don't forget. They're very grateful to you in the end. I did have a lot of patients who walked out the door thanking me for everything I did for them. And I will never forget that. Um, as hard of a job as, it was rewarding being told and knowing that you were making a difference. But I will come back and I will share more of my stories, not only on rehab and the other floors, but also working in other departments in the healthcare field, doctor's offices. I know I've heard before somebody comment that topic would be boring, but it's not boring. It's very hard work, but I will definitely share more stories and also more stories about working in home health as well. So keep tuning in and keep sharing my videos and subscribe to my channel if you can. And I look forward to talking to you again. You have a wonderful day.